Here I have written no more sinus lift. So I don't want to discourage by this statement. Yet this is one of the uh, alternative implant procedure for the sinus lift, that is the pterygoid implant or the zygomatic implant. So before diving into this topic, I will briefly discuss about the anatomy of this maxillary sinus. So what we have is the anteriorly, the premaxilla, the posteriorly we have the pterygomaxillary bone, and superiorly we have the orbit, and slightly superiorly as well as laterally we have the zygomatic bone. Or the in this bone we are going to place the screws and the implants. So let's take clinical scenario wherein patient is going to walk into a clinic, and when you do the intra-oral examination, you find that the resolved ridges, OPG is going to show the sign of the maxillary sinus which has been completely expanding. So this is the ideal place where you are supposed to place the zygomatic implants. So this is the tip we have been following. If the maxillary sinus, if it has been completely expanding, even the ridges have been resolving. So this is one of the alternative procedure. So alternative, first thing, we are choosing it as an alternative procedure for sinus lift. So in this sinus lift, what we are supposed to do is, we are going to place something called a bone material, which is called a bio-os. So next again to this, we are going to wait it to get integrated with the bone for again 9 months, 6 months, and then place the screw and wait for 6 months. So again, this is a time-consuming cost, very much costly for the patient. So alternative to this procedures, we have introduced other concept called as the all basal cortical, which means 2 implants on the right and left side going into the premaxilla, and 2 on the pterygoid plates. If the maxillary sinus, if it is showing the sign of the expansion, and again the premaxilla, if it is being completely get resolved, so we can place 2 implants directly into the pterygoid plates over here, as well as 2 implants into the zygomatica and 2 implants into the premaxilla. Again, one more case, that is the 6th case, in which it shows that quad zygoma. What is quad zygoma is that we are placing 2 implants over the zygomatic bone on the right side as well as the left side, and one on the left side as well as one on the right side into the pterygoid bone. So by making this procedure of the zygomatic implant, one can save the time, first thing. Second thing is that we can obtain the better retention as well as that stability as well as optimum torque for the implant we get placed. So second thing is the pterygoid implant. So this is one of the pterygoid implant is one of the procedure which can be used along with zygomatic implant, in which we are choosing, we are configuring the complete distal-most portion of the maxilla. So if you configure the distal-most portion of the maxilla by that approach called as the maxillary tuberosity approach, so one can use that instrument or the ornamentarium. Here the ornamentarium, it plays one of the vital role here. That ornamentarium called as the C finder or the cortical bone finder. So by using that cortical bone finder, we are going to approach into the tuberosity to one zone called as the fusion zone between the pterygoidal, lateral and medial pterygoid plates. If you get that resistance, then game is over. You hit that place and you place the screw and then load the implant and go for the retrieval process. So here instrument of choice what we get is the C finder or the cortical bone finder. So it has greater resistance and as well as it has a good taper. So by introducing it over the tuberosity and getting the resistance over there, we can even avoid the assistance help, because it can change the angulations if the assistance has been holding them. So this, by even removing this, by getting that compaction effect of the bone with that screw, one can even avoid assistance help and can obtain the maximum torque, optimum torque which has been required for the implant placement. So this is about the zygomatic and pterygoid implant. Now conclusion for this thing is, here this is one of the costly procedure, but yet if the patient wants this, and again patient case, if it is clinically, if it is been requiring, go for it, because this is one of the trending topic which has been going all around India. And again other implants are also being available, mucosa implants, zygomatic implants, pterygoid implants. So yeah, this is about the pterygoid implants, zygomatic implants.